A 2026 prospective cohort published in NPJ Breast Cancer reports that women who eat the most flavonoid-rich foods have about 15% lower breast cancer risk than women who eat the least. That headline is everywhere right now. I'm Michael Merth, a registered dietitian who spent years in oncology nutrition, and I want to show you what that number means, what it definitely does not mean, and what to actually put on your plate. Start with the word, because it gets thrown around like everyone knows it. Flavonoids are a family of compounds that plants make, and they're a big part of why plants have color. The purple in a blueberry, the bitter edge in green tea, the sharp bite in a red onion, those are flavonoids. There are several subclasses worth knowing. Anthocyanins are the red and purple pigments in berries and red cabbage. Flavonoids are the ones in green tea, cocoa, and apples. Flavonols include quercetin, which is heavy in onions, kale, and capers. Flavonoids live in citrus. Nobody eats a flavonoid. You eat a berry and it contains dozens of them, plus fiber, plus vitamin C, plus 100 other compounds. Hold on to that because it matters at the end. Now the finding. Compare people with the highest flavonoid intake to people with the lowest. And the high intake group shows roughly 15% lower breast cancer incidence. 2 words in that sentence carry all the weight: compare and incidence. This is observational research. Nobody assigned anyone to eat berries. Researchers followed large groups of people, recorded what they ate, and counted who developed cancer years later. That design can find associations. It cannot prove cause. And here's the honest problem with all nutrition epidemiology. The person eating the most blueberries, kale, and green tea is usually different in a dozen other ways. They tend to smoke less, drink less alcohol, move more, weigh less, sleep better, and have better access to care. Researchers use statistics to try to strip those factors out, but they can never strip them all out. That leftover contamination is called residual confounding, and it is the reason a 15% association is not a 15% guarantee. Now the other side, because I'm not here to tell you the finding is noise. There's real mechanistic plausibility here, and that's what separates this from a random correlation. Flavonoids are antioxidants, which means they neutralize reactive oxygen species, the unstable molecules that damage DNA. Damaged DNA is where mutations begin. Some flavonoids modulate inflammatory pathways. Quercetin, for example, dampens signaling through NF-kappa B, which is a transcription factor that switches on inflammatory genes including TNF-alpha and interleukin-6. Chronic inflammation is a well-established contributor to cancer development, and several flavonoids show weak activity at estrogen receptors and appear to influence aromatase, the enzyme that converts androgens into estrogen. Since a large share of breast cancers are hormone receptor positive, that's a mechanistically interesting place to be poking around. So we have a consistent association plus a believable mechanism. That combination is worth taking seriously. It's still not proof. One more detail from the 2026 cohort earns your attention. The lower risk held up even in women carrying a high genetic risk score for breast cancer. Family history is the thing people feel they can do nothing about. If diet nudges the odds even a little in exactly that group, that's one of the few levers you actually get a hand on. The standout subclasses in that study were flavonoids and proanthocyanidins, which is a technical way of saying citrus and apples pulled the most weight. And here is where people take a reasonable finding and wreck it. They buy the supplement, a quercetin capsule, a concentrated green tea extract. The logic seems airtight. If the compound is the good part, take more of the compound. It does not work that way, and sometimes it backfires. High-dose green tea extract has been linked to liver injury. Concentrated antioxidant supplements are a genuine concern during active treatment, because chemotherapy and radiation kill cancer cells partly by generating oxidative damage, and flooding your system with high-dose antioxidants at the wrong moment may blunt the very mechanism you're paying for. That's why I tell people in treatment to clear any antioxidant supplement with their oncology team first. The whole food is not the same as the extract. The dose is different, the matrix is different, and the safety record is different. So what does this actually mean for your plate? Eat the plants, not the pills. Berries and frozen count, they're picked ripe and they're cheaper. Green tea. Citrus and eat the segments. Don't just drink the juice because the fiber comes with the fruit. Red onions, apples with the skin on, because that's where the flavonoids concentrate. Dark chocolate, real dark chocolate, in an amount that fits your life. Aim for color and variety rather than one hero food. Different subclasses come from different plants, and the studies measure total intake across all of them. And keep the size of this honest. 15% lower risk is meaningful at the level of a population. It is not a shield. It does not replace screening, it does not undo smoking, and it does not cancel out alcohol, which has a far stronger and far more established link to breast cancer than flavonoids have to protection. Berries won't save you. But eating this way, over years, stacks the odds in your favor, and it costs you almost nothing to do. What's the one food you've added since your diagnosis, or since someone you love got one? Tell me in the comments. And if you want the free guide to building a plate that supports prevention, the link is below.